Very often we hear the terms "Yeah, أنا كتير مدبرس اليوم" or "Yeah, ليه مدبرس, come on, just cheer up, snap out of it." Unfortunately, the terms used to describe mental health disorders are taken very lightly in our society, and that is wrong. For example, depression. Depression is a serious mental health disorder. In order to show you how depression is very toxic and actually very serious, I'm going to read Sadia's story with depression that was posted on Embrace's website. Depression is a battle. It's a war inside you. It is painful, it aches you physically, and it burns out your mind and your heart. It's something inside you that you can never control, sometimes not even by medication. It's when you think of ending your life, not only by suicide, but also thinking that sleeping is the only solution while waiting for your body to catch up with your already dead brain. My depression was never an excuse, nor is it a made-up thing. It is real and is paralyzing. Depression to me doesn't mean getting nervous or being down for a few minutes. It is when my legs can't hold me, I am not able to breathe, and I shake like I've experienced hypothermia. This is just an example of how serious and how heavy and how tough mental health disorders can be. Depression is a big umbrella term under which many depressive disorders exist. You have major depressive disorder and persistent depressive disorder. These are the main two and the most common. One common feature of all of these disorders is sad and empty and irritable mood, as well as changes in cognitive, meaning thoughts and memories, and somatic, meaning bodily functioning. The differences between these disorders lie within the duration of the symptoms of the disorder, so for how long you experience the symptoms, the onset, meaning when you actually begin to experience the disorder, and the etiology, meaning how this disorder rises. Major depressive disorder is very common, especially with children around puberty and with people in their 20s. However, it could happen at any age. I'm going to list a bunch of symptoms, and to be diagnosed with major depressive disorder, you have to have 5 or more of these symptoms for a period of 2 weeks. And at least one of these symptoms has to be depressed mood for most of the day, or loss of pleasure or interest in most of your activities. The symptoms are depressed mood most of the day, meaning you feel empty, you feel down, you feel sad, or for kids, they could feel irritable. Significantly loss of interest or pleasure in most of the activities that you used to enjoy. Significant weight loss or weight gain. Psychomotor agitation or retardation, so you're either very restless or you're very slow. Insomnia, your inability to sleep or hypersomnia, sleeping way too much. Fatigue or loss of energy, so you're always tired. Also feelings of worthlessness and excessive guilt. In addition to difficulties in concentrating and making decisions, as well as recurrent thoughts of death and suicide, and maybe thinking of suicide with a plan or without a plan, or attempting suicide. In addition to these symptoms, they have to cause significantly clinical distress or impairment in social functioning, occupational functioning, and other areas of functioning. Also, these symptoms should not be the result of medication or a medical condition, and they are not accompanied with a manic episode, which is something we will talk about later. Persistent depressive disorder, which was referred to as dysthymia in the past, is actually a more prolonged and chronic version of major depressive disorder, and the symptoms are quite similar. However, it is, as I mentioned, the duration and how many of the symptoms required for you to be diagnosed with this disorder. The symptoms include depressed mood for most of the day for at least 2 years for adults, or irritable mood for children, and for children and adolescents for at least 1 year. Also, you should have at least 2 or more of these 6 symptoms: poor appetite or overeating, insomnia or hypersomnia, fatigue or loss of energy, low self-esteem, difficulty in concentration and making decisions once again, and feelings of hopelessness and worthlessness. Also, these symptoms have to cause clinically distress and impairment in areas of functioning, and they should not be because of medical conditions or medication, and not accompanied with a manic episode. It is important to note that major depressive disorder can precede persistent depressive disorder, or it can come with it. So whenever you have PDD and you experience MDD, you're giving a diagnosis for both. Now, I'm not going to cover the other disorders in detail, but I'm just going to go over them quickly. premenstrual dysphoric disorder is basically for females. They experience this disorder, prior to their period, and it's about, experiencing these extreme heavy symptoms of depression. It's not just being emotional or sad or having cravings, it's actually extreme symptoms that affect your functioning. And disruptive mood dysregulation disorder for children, psychologists tended to overdiagnose children with bipolar disorder and to medicate them a lot. So it was like an attempt to inhibit this tendency to overdiagnose and put children on medication immediately. It involves depressive symptoms, but also irritable mood and the inability to control children's behavior. How does depression happen? Actually, this is a very, very broad question, and there are many factors that could come into play. In psychology, we never say this causes that. It's very actually risky to give such a blunt, generalized statement. We always talk about risk factors. Risk factors are basically factors that increase the likelihood of something negative happening, such as mental health disorder in this case. So they're always highly correlated with the disorder, but there isn't necessarily a causation. Some risk factors include temperamental risk factors, meaning طبع. So if you are a neurotic person, meaning generally an anxious person, a stressed out person, شخص بيضل موتر ومنرفز, your likelihood to experience depression increases. Also environmental factors, of course, experiencing adverse events or experiences as a child has massive impact on your mental health, and also stressful life events. Also, we have genetic and physiological influences. For instance, if any of your parents struggle with depression, your likelihood of having depression is greater than the general population by around 40%. If you tend to struggle with another mental health disorder, which is a non-mood disorder, meaning something that is not related to depression or bipolar, this also increases your likelihood of struggling with depression. How is depression treated? There are tons of approaches, tons of therapy. Medication has proven to be effective, such as antidepressants and mood stabilizers, as well as different psychotherapies such as cognitive behavioral therapy, interpersonal therapy, family-focused therapy. But the best way to tackle depression is a combination of medication and psychotherapy. So I hope the next time you come across someone who is experiencing depression, or you yourself experience depression, you do not take the matter very lightly, very sarcastically. It is a serious mental health disorder, and as you can see, the symptoms can be very taxing and very draining and, just very tiring for an individual. I hope this way you tend to be more supportive, more loving, and more caring toward people who experience this disorder. I hope you guys enjoyed this video, and if you did, please let me know so I can be covering other mental health disorders. Thank you.